here with you all today. As Sabrina said, my name's Tammy Taylor, and my pro-life journey began when I was very young. I went to Catholic schools, K through 12, and I remember in middle school joining those pro-life marches and going down and being sidewalk advocates. And I just couldn't understand. I loved babies, whether it was puppies or kitties or real human babies. I just couldn't understand how humans could kill a life that was so uniquely a living person. It just didn't make sense to me as a young, preteen teenager. I just couldn't understand it, and murder was a sin, and I didn't understand the difference that people could twist it in their mind to be okay. So I dreamt, when I was around that age, that was the 80s. Saline abortions were the big way that abortions were performed, and some babies would be born alive, and I used to dream of saving those babies. I was told that they would be just put in a room and they would be allowed to die by themselves, and I just couldn't imagine that. So I would have dreams that I'd go into these hospitals and I'd find the babies and I'd save them. And I knew that God was working on my heart, and eventually I did, as I am now, go into a field where I can help babies. It's just a little bit different these days. I knew of Guiding Star, which started out as a pregnancy center. It was Life Choices Women's Care, and I knew the director, Anna Stooks, and it was probably around 2009, and I said, I was a nurse then, labor and delivery, and I said, I'm going to go back to school. I'm going to go and become a provider so that I can take care of these women that are coming to you vulnerable and in need, and so that way you don't have to send them to somewhere else, because pregnancy centers are wonderful, but then they'd have to send them somewhere else, and sometimes they might not be hitting a pro-life person. And they get to that office and they're saying, oh, you didn't want this baby? Well, here's your options. And so when I approached Anna, I said, we can keep these women here and show them that they can do this. And so I went to school and graduated in 2013, and approached Anna again and said, okay, I'm done. I'm now a certified nurse midwife, and I can take care of these women. So we started kind of plotting around then and seeing what we could do, and it wasn't until 2016 that I actually started at Guiding Star and became their provider for the women, and started to expand and saw GYN, but the main focus was keeping the pregnant, vulnerable women in the center where they could be helped the most, because it's a culture of life, whether it's a woman, a child, a man, or an infant, or a newborn baby, or a baby within the womb. It's a culture of life, so it's uniquely different when you build these centers. It was around that time that I began to notice a trend, because I'd been familiar with the surgical abortions, but we started seeing women that had taken pills, not to be confused with Plan B. Plan B is you have intercourse, you're not pregnant, the next day you take a pill, it stops ovulation. If you've already ovulated, it can stop implantation. So it's not the abortion pill. Plan B is something separate. Plan B you can get over the counter at the pharmacy office. So the abortion pill is where women go, they find out they're pregnant, and they're offered a quick fix to their problem, which is an unplanned or an unwanted pregnancy. As Sabrina shared, I have 12 children. And even if you plan your children, sometimes you have that thought, oh my gosh, what am I going to do right now? And so these women at the most vulnerable time in their life are told, here, you can just take this pill and you're going to have a miscarriage. So imagine yourself sitting there at 16. Your boyfriend's told you that he is not going to stay with you if you have this baby, and you're being offered a pill that you can take, and you can go home and you'll just have a miscarriage in your home. And they're like, okay, I'll take it. They're not given any time to process. They're in some cases encouraged to take it by saying, you're still in school, you have your life ahead of you, or a married person who's having marriage difficulties. You don't know what your husband's going to do if you come home pregnant. You know, this is another option. You can just have a miscarriage. Or the family who already has 5 or 6 children, and now they're being given this option so that they don't have another mouth to feed. These are all things that I've heard from women that have come to me, that they were told these things to help them to make their decision to take this pill. So they take the pill, and it's given to them in the office. They take the first pill, then they're given a little baggie of 4 little other pills that they take with them home, and they're supposed to take it 24 to 48 hours after they take the initial pill in the office. So the first pill that they're given is mifepristone. It's the RU486. Its method of action is progesterone is needed for pregnancy. It's what helps the placenta to nourish the baby, provide oxygen, nutrients. It keeps the pregnancy alive, if you will. Progesterone has been used for over 50 years. It's used for people that have a history of preterm labor, people who have a history of miscarriages, people who have a luteal phase defect, which is known if you do any fertility awareness. I work with a lot of people doing fertility awareness, and we know that they have those issues. Even if they've never had a pregnancy before, I start them on progesterone when they want to get pregnant. So we've used progesterone for years, and they started thinking, Dr. Delgado in California started thinking about, well, if the mifepristone blocks the progesterone, and so its method of action is to block the progesterone so that you don't have a viable pregnancy. The pregnancy basically is snuffed out. The nutrients and oxygen is blocked by no progesterone being there. So his thought was to flood the body with progesterone so that the bound progesterone, because of the mifepristone, there would still be more natural progesterone in the body to sustain the pregnancy. So with the mifepristone abortion pill, about 85% of those turn out to be an abortion if they take all the medication. 15% need to go on to have a surgical abortion, a failed abortion. They have found that adding the progesterone, if a woman comes within 72 hours to us for treatment, adding the system to the body, progesterone, actually increases those odds to 75 to 80% success rate in keeping that pregnancy healthy. That's a big difference. So these women come to us vulnerable. They go out of the office. They're often felt like they were coerced into taking that. I had one woman tell me that as she was taking it, she was thinking, I can just go in the parking lot and throw it up. So as they're taking it, they're thinking this is wrong. And then they Google, abortion pill reversal, or I took the abortion pill and I'm sorry. They hit upon the abortion pill reversal rescue hotline, call the line, and that gets them in contact with myself or our other two providers who are now with Guiding Star. And we call them immediately. We talk to them about when they took the medication, what time, are they having any symptoms. Even if they're having spotting or cramping, we always start them on progesterone. We get them into the office as soon as possible. We have a sonographer at our clinic. She's there 3 days a week. She has a full schedule, but we get these people right in. We check out the pregnancy. We make sure it's a viable pregnancy. We see that patient every week for an ultrasound. We check on them. They're seen weekly until 10 weeks, and then they're seen every 2 weeks until 14 weeks, and then they're released to regular care, whether that be to stay with us at Guiding Star or go to somewhere in their area, because we have people come from far away, as far as Sarasota, Riverview, Brandon. We have people come from all over for services for the abortion pill reversal. So I lost my train of thought. Okay. So the abortion pill reversal, from the time that we see them until they graduate at 14 weeks, is typically around 6 to 8 weeks, depending on when they found out their pregnancy. We have had some that aren't successful, and I've found that most of those, or a significant portion of those, were women that I think would have already had a miscarriage anyway. So they went to the first provider who told them that they were pregnant. They do a quick ultrasound just to verify dates, because you can't be more than 9 weeks pregnant to take the abortion pills. So they do a quick ultrasound to verify dating, and when they did that ultrasound, they report that they didn't see a fetal heartbeat, or that the age of the baby was smaller than the woman thought it was, which is another indication that it could have been a miscarriage and just missed. But they gave them the abortion pill anyway. So I think that some of the ones that we consider losses would have been a miscarriage had the woman just waited and seen and not taken any drugs. So I think that our success is a little bit higher. If you look at the overall miscarriage rate without the drugs, miscarriage rate is about 1/4, so 25% to 1/3, 33% of pregnancies end in miscarriage. And a lot of those are very early, and so the woman doesn't even know they're pregnant, and then they just are a little late, and then they get their period, and those were actually miscarriages. So I think those are some of the ones that we're getting, but the vast majority of our women are success stories. We've had 2 sets of twins who took the RU486, the mifepristone. They contacted me at the center. I was able to get them the progesterone within the 72 hours. We got them right in. We found out they were having twins, or we've got lots of singletons, and they went on to have healthy babies. And so this is one of the things that really touches my heart, because these are the women that suffer, I think, a lot, because in their minds, they're the ones that caused this. A lot of abortion is horrible in any aspect, but when you go in and the doctor does it, it's a lot different than you're taking the responsibility for taking these pills and creating that. And I've had women that just will break down in my office crying because they took that first pill and they're so scared that something will happen to the baby. A lot of their worries are, okay, I've taken these pills, now do I have to worry about, birth defects or, something going to be wrong with the baby? And the studies that they've done so far show that taking the mifepristone alone and the progesterone combination, there is no increased risk of birth defect as the normal regular standard population. So there's no increased risk. We do have some clients that will take both sets and come to us. They're looking at new research to see if they can add something to the protocol to help these women that have taken both. So the mifepristone blocks the progesterone. The misoprostol actually causes contractions, uterine contractions, to expel the baby. So that's why we try and get them between the two, because the second set of pills that they take actually cause contractions and labor, if you will. So we try and get them before that. There has been some success in blocking the miscarriage from that point, from that abortion, using higher doses of progesterone. So they are doing studies on that. There is an increased risk of with misoprostol, I think it's an increased risk of something with their lungs. I can't remember offhand, but it's not significant enough to warrant saying to go through with an abortion. So we have helped some of these women, and we are trying to get the word out there, especially to sidewalk advocates, because the women that are going in these centers, that's the number one thing that they're being offered. Are the pills. And they have no idea that there's a reversal. And now that the abortion community knows that we are doing what we're doing, they're trying to counteract it by instilling fear in these women, by telling them that you can't reverse it, and that if you try and reverse it, you're putting yourself and your baby at risk. So, just being knowledgeable about the whole process so that you can tell these women, there's been studies, we use progesterone, we've used progesterone in pregnancy for over 50 years, it's safe, you and your baby will be fine. So it's just being more knowledgeable about the whole process. And, opening more pro-life medical clinics so that the whole clinic and the whole culture is following that pregnancy, and not only for that woman, but for the men, the other children, and the babies. And so that's what we're doing at Guiding Star. We've now added we added a women's health nurse practitioner last year, and that was 2 APRNs, myself and her. And then just a couple of months ago, we added a family medical doctor, so now we actually have a physician that can take care of our babies that are coming through, seeing us for prenatal care and postpartum care, and now Dr. Mariana can see the babies and the families and the men that also need support. So it's just a big blessing to be a part of this culture of life, and I'm so happy that I heard that other places are trying to establish that culture. So, any questions? Yes.
The reversal, is it a pill?
So progesterone can be given.
Injection.
It's not what?
It's not an injection or something?
So it can be given in injection form, it can be given in suppository form, and it can be given in oral form. In the beginning, it used to be given as injections, but they've done more studies to show that oral is just as effective and it doesn't hurt as bad. So we use oral. Yes.
Some of us here are from Bread and Roses,
Mm-hmm.
and Katie Kelly had expressed that a couple of clients went to, I think, to your clinic.
They could have. We get a lot of referrals from other places, and we're very thankful. We will help care for any woman that comes to us in need. We take insurance now, we have sliding scales, we have grants. We don't turn anyone away. Yes.
Is there a moral obligation for clinicians who work in the pro-life field to treat the spiritual as well as the physical?
I would say yes.
Are they doing it?
At our clinic?
Yes.
Yes. Yes. Yeah.
Is that referred to another clinician or another professional? How
No,
does
we
work?
do it, we integrate care as a whole. When I see a person, I meet them where they're at. And so you can kind of get a feel for where people are at spiritually, but we always want to let them know that we are here for them and we don't judge them. And I think that that's a big thing, because these women are gonna live with that, whether it's a success or a failure, the rest of their lives. So you might think that they'd be okay if they had a successful baby, but they're not. They have to live with that decision that they made. And so we meet them where they're at and we see them through that. And we have Christian counselors that we can also refer to if they need. Some of them need a little bit more, but we always incorporate, like we say, mind, body, and spirit. So we kind of treat them as a whole patient.
So you would refer them to like another Catholic priest if they needed that?
If they needed it, sure. Yeah.
But you also take non-Catholics, right?
Absolutely. Yeah. We don't come out and say that we are Christian or affiliated with a religious denomination. But if you go in, you can tell the culture is it's a religious culture. I mean, we have a psalm on our ceiling, and we have